Shoulder impingement is a major source of shoulder pain today in our flexion-addicted society. So stay tuned because we're going to do some self-massage to alleviate that shoulder pain. So number one, you want to look at your posture. Poor posture, shoulders rounded forward, is a major player in shoulder impingements and cause a lot of problems. So I want you to have a comfortable seat. Make sure your weight is even on your bottom, on both hips. Sit up nice and tall. So you want each vertebra stacked one on top of the other, space in between. Feel yourself lifted like there's a string attached to the top of your head and you're being pulled up nice and tall, and shoulders relaxed down and back. This should not be a tense posture. It should be relaxed even though you are lifted and the chest is open. It should feel nice. And speaking of the chest, that is really a key player in pulling that shoulder forward. So we're going to start with the pectorals, pectoralis major and minor. Make a soft fist, and you're going to be using these knuckles to just make nice massage circles, picking up the tissue, picking up the fascia, and just moving it around all through here. Those are all the pecs. And it should feel pretty nice. If it's feeling very tender, back off. You don't want any pain. You just want it to feel good. If it's a little bit sore, it's okay, as long as you're getting a nice release along with it. And it's very tolerable. So just getting all around front of the shoulder, finding spots, finding any tender points. And when you do, just hold it right there. Just apply the pressure right to that point. Not so much that it hurts, but enough so that you can feel it relax. And what you can do is add some active movement. So we're holding that sore spot, right? And then you're going to bring your arm across, glue that elbow to the body, and open it out. Internal rotation, external rotation. So you're just swiveling the arm in the socket. And with external rotation, you'll get a nice opening and stretch. And then you can go on your way and find some more spots. If you'd like more specific pressure, we can go to the fingers now. And you can kind of get in there a little more specifically into the different fibers. And of course, when you feel a good spot, you can hold it and do that. Internal, nice and slow, all this movement very slow. External, you'll feel the muscle moving under your fingers because it's being activated. And this active release is so nice, so good for the neuromuscular system, really incorporates that brain, those neural pathways into the movement and into the muscles. And then we'll come to the front of the shoulder. It might feel a little tender there, might feel a lot tender. If you kind of string across, you're gonna feel this like little twang over a tendon, almost like a guitar string that runs up and down. That's your biceps long head tendon. And that is a big player as well in shoulder impingement syndrome. So you can just start with some nice circles there. Again, not so much that it hurts, but enough so that it relaxes. And then you can just apply some pressure and we'll add a little of that active movement. So this time you're just going to flex the shoulder forward and extend it back. I'm just coming forward and back. Nice and slow. You'll feel that tendon move. You'll feel it stretch. So go easy. Forward flexion, back extension. And then you can find another place. If you want, you can do a nice broad pressure with the whole palm and just sort of squeeze it out, opening up that shoulder, spreading the front, spreading that tissue. And then you can really hold it right there and do that nice flexion, extension, flex forward, extend back. And just give it another couple squeezes. You might as well squeeze those deltoids while you're at it. Why not? The whole shoulder needs it. And then we're coming to supraspinatus, which can literally be a real pain. So we'll go easy. And it's a little tricky to find, but I know you can do it. So you've got your scapula, your shoulder blade, this big triangle, right? If you go towards the upper side of the triangle, you'll feel a bony ridge, a big bony ridge that just goes all along. You want to go right on top of that. So you can see here's my bone, the bony ridge. I can go right on top of that and in. Here's the bone, there's the soft tissue, right? So you'll feel it right above that ridge. And that is your supraspinatus muscle. Also, very, very commonly a cause of shoulder impingement syndrome. And in fact, that tendon goes underneath or through that little subacromial space we spoke of and often gets pinched and causes a lot of pain. So let's just massage the muscle right now, leaving the tendon out of it. So I'm just doing circles with my fingers. Try to make sure this shoulder's not creeping up, that it's nice and relaxed. And just massaging. You can go from inside to out, medial to lateral, just spreading. And then if you continue to follow that muscle, so I'm relaxing my arm down now, continue to follow that muscle all the way, just making sort of a straight line all the way to the shoulder, and then on top of the shoulder, and you might find a spot that is acutely tender. That is probably on or near your supraspinatus tendon. It's actually extremely difficult, if not impossible, to palpate that directly, but you can certainly get the tissue around it. And so I found mine right over here at the top of the shoulder, and you can just do some little circles. If you didn't find it, that's okay, just explore. And when you find that tender point or a tender point, you're going to do just a little active movement. So hold static pressure right on that spot, and then you're going to abduct or bring your arm away from the side of your body, and adduct or bring it in towards your body. Little movement, just out and in, out and in, while holding. Out real slow and in. And you can keep going like that for a few moments. Nice deep breaths while you do it. Make sure both shoulders are relaxed. And then gently let that spot go. So with the side that you're working on, take that hand, reach under your chair, and get a nice grasp. We're going to keep that shoulder down as we bring the opposite ear towards the shoulder. Don't let that shoulder come up with you. Really stabilize it down. Hold on to that chair and bring the opposite ear towards the opposite shoulder. Get a nice release, a nice long stretch in the upper trapezius, levator, scapula, all those shoulder elevators that want to bring our shoulder up to the ear. We're going to take them apart and lengthen. If you'd like a little more of a stretch, you can place your hand, not push, but place your hand on your head. Relax your arm, relax your shoulder, and just allow gravity to deepen the stretch. Keeping that shoulder down and lengthening the side of the neck. Feels so good. Take one more nice deep breath here. Slowly release your arm down. Slowly bring your head up to center. You always want to go in and out of stretches very slowly. Roll the shoulders back. Think about squeezing those scapula or the shoulder blades together like you want to hold a pencil in between them, but also pressing them down like you want to move them down the back. So another way to think of it is to take your right shoulder blade and try to put it in your left back pants pocket, and your left shoulder blade and try to put it in your right back pants pocket, and just give yourself a nice stretch that way, opening up the chest. You can bring the arms out so that the palms face the walls, and just breathe, feel open, get tall. Remember that posture, that separation between the vertebrae. And relax your arms down, and hopefully this has released a lot of pain and tension for you. It is possible, if this is something that's been going on for you for a while, that you've had some weakened muscles, so you might want to try physical therapy. I would recommend it to strengthen the rotator cuff and other shoulder stabilizers. That will be a big help for you. But in the meantime, I do hope that this helped, and if it did, do give me a like and subscribe to my channel. I've got a lot coming out, so hit the notifications bell so you won't miss out. Comment below, let me know how this worked for you, share your story, and I will see you next time.